Hey everybody, we're still continuing to adapt along with everybody else in these times. And a couple weeks ago, we had Dr. Paransevich out of University of Iowa. Last week, we had Dr. Rosa from Des Moines. And today, deeply honored to have Dr. Megan Srinivas. Thank you so much for joining us. How are you doing? How are you holding up?
Oh, thanks for doing this, JD. I'm doing great. I'm really glad to see that people are trying to get the positive message out and trying to get the facts out to the public. So this is wonderful that you've been holding this series of events.
Yeah, well, before I have a few questions we'll start off with, but if anybody does have questions, put them in the comments below. We'll try to get to as many as we can. We want to be respectful of the doctor's time. And so with that, I would love to open it up to you and just, again, we've had two previous doctors on this. You're infectious disease. Can you talk a little bit about how rapidly things are changing and bring us up to speed of where we're at here in Iowa and the timeline and everything?
Yeah. So with this virus, there's so much that we don't know about it. And every single day we find out some new facts about the virus that completely can change the trajectory of the disease. When we look at the nation as a whole, we're facing a lot of resource shortages, from healthcare workers to personal protective gear, which includes masks to protect those workers, to test kits, just to ensure that we're actually identifying where this disease is striking and who's even infected. Those resource shortages have only continued to exist. And here in Iowa, where we're one of the later states to be struck by this, we're in a situation where we haven't amped up those stockpiles sufficiently because the federal government, with their current resources, are trying to distribute it to the places that are currently hot zones. So that's something that here in Iowa, we really need more attention to. We need the federal government realizing that we are next, that we are coming down the line of having a lot of cases, and we need ventilators, we need the healthcare workers, we need the PPE, we need those things here too.
Yeah, and a lot of talk right now is, especially over the weekend, there was talk about the peak of this disease, and it's. I mean, I understand why it's changing because this is all new in adapting. But can you kind of talk about what the peak means and what it means for us around here?
Yeah, so the trajectory of the disease, from what we've seen in prior countries, because we haven't really reached a peak per se anywhere in the US that we can guarantee has already happened. But looking at other countries like China, like Singapore, looking at Hong Kong specifically, or even Italy and Spain, we see what typically happens is with this disease, it climbs quite exponentially. So it's a big curve that climbs quickly. When you see one case, it can spread really quickly to three cases within a day. And each of those people then spreads it to another three cases within a day. And because of that, we have what we call exponential climb in the number of people who are being infected. So the more people who are infected, the steeper that curve is. When we hit that peak is when we're saying, okay, we've hit the point where we're having the highest number of infections that we will see, and we're going to start coming down the other side of the curve. The problem is we don't know when we're going to hit that peak. And a lot of that has to do with the fact that we don't know all the infections that are out there, and we don't have enough test kits to identify all of the infections that are out there. On top of that, we really can't hit that peak until we stop the spread and control the spread that's happening right now. And what's fundamental to doing that is the public health interventions, like the social distancing and staying at home, to ensure that we're not inadvertently spreading the virus between people by mistake.
And what about masks? I had to, right at the very beginning of this, I actually had, it wasn't, I didn't have the symptoms, but I had something else. And so they gave me this. And so um, I kept it just because
Just
to keep. And what, I mean, you see more and more people wearing masks. What are your thoughts on kind of that? My mom's a public health director, and she'd make me wear masks way like years ago. And so, what are your thoughts kind of on about that?
Yeah, so there's a lot of data on both sides of the fence when it comes to masks. And there's also different types of masks.
Yeah.
So the most sturdy, the most bulk mask that we really need the healthcare workers to have is called an N95. It's what's often used when you're coming in contact with anybody who has TB, but any infection that we call airborne, which means that The droplets are so small that can pass this infection that it can hang in the air for a while. And so if you're even breathing the same air, you're at risk of getting it. We're not sure if COVID-19 falls into that category or not. We still need more information. But because of that, anytime that we're doing a procedure like intubating somebody, we're trying to reserve the masks for people who are performing that procedure or in the vicinity of that procedure, because those procedures aerosolize the virus and make the people surrounding that person at a much higher risk of getting that infection. And
What's
so,
that word? I'm sorry. The
oh,
aerosol?
aerosolize. Yeah,
Yeah.
aerosolize. Basically, it turns the virus into the smaller particles that enable it to hang out in the air.
Okay.
So, and that's when we're doing the in-depth procedures like intubation, things like that, that involve a person's airway, that
Okay.
somebody in a grocery store wouldn't have that same exposure.
Okay.
So that's why we're saying save those masks for the healthcare workers, because we don't even have enough for them right now. And then the next step is we're trying to use surgical masks, even though when we first started doing this pandemic and handling the pandemic, we said we wanted N95s for any healthcare worker, because there are in the areas where even if they might not be intubating now, they might have previously, or they might be planning to, or they're really close to patients and really close to the droplets that are coming out. So it's the safest thing. Unfortunately, because of lack of resources, we're now recommending surgical masks when you're not doing intubations, not doing procedures that are going to cause you to have as high of a risk exposure, but still a high risk exposure.
Is
We still don't know if that's a safe option.
okay. Is
Yeah.
there a shortage of surgical masks as well as the N95 or?
There are. So throughout the country, there's a shortage of surgical masks as well, which is why the whole question as to whether we could use cloth masks and bandanas came up.
Yeah.
There's one paper that came out in 2015 that shows that cloth masks for a healthcare worker who's having very close contact, so this means the nurses, the physician's assistants, PAs, nurse practitioners, the doctors, the people who have extremely close contact, respiratory therapists with the patient, the cloth masks are not effective at keeping them safe. So that's why it's really important we save these surgical masks, we save the N95s for them. The place where the cloth masks might come in handy is out in the general public. Even though you're practicing social distancing, staying 6 feet away from people, we're not sure exactly how far these droplets can actually travel. And to protect yourself, even if you're practicing social distancing in grocery stores, etc., people who are sick, who wear the surgical or not surgical, who wear masks and protect themselves from having those droplets come out, can protect those around them. And the fact that 80% of people who are infected with COVID-19 have either very mild symptoms or no symptoms at all, and might be passing this infection without realizing it. That's the reason you've seen some of the shifts suggesting that maybe the general public, when you're out and about in grocery stores, should wear these cloth masks. It's really to protect others from getting a virus that you might be transmitting without knowing it.
So it's not so much they're protecting themselves from others, it's they're the ones who are looking out for the other people.
Exactly.
Yeah.
Exactly.
Okay. Very cool. One of the things I see a lot on social media, especially here in kind of Northwest Iowa, because the numbers, it took a while for us to get confirmed cases here. And so when you don't know someone who's sick, there kind of is that false security that, oh, it's not going to happen here. I guess, what can you do to address that? And that's, I don't know. I'm seeing it more and more of folks. But now, I mean, I think we're at 77 of the 99 counties have a confirmed case. So hopefully it's not as people aren't thinking like this as much. But what do you suggest about folks who have that kind of mindset right now?
Well, the thing that people need to remember is we're not testing everyone. We're not even testing most of the people who we suspect might have mild symptoms and actually might have coronavirus, because we don't have enough tests. Nowhere in the country does. So right now, the CDC guidelines for who gets a test are those that fulfill the fever, the cough, and are more severely ill or at higher risk, have had exposures, potentially either through travel or somebody else who is sick, which those restrictions alone cut out most of the people that could be experiencing coronavirus in our communities, and we don't even know it. So it's extremely important we realize coronavirus is here. Just because we haven't identified it doesn't mean you're not at risk of getting it and passing it along and somebody else falling really ill and potentially dying.
Yeah. And you're in Fort Dodge, I'm here in Sioux City, and pretty much everything in between is very agricultural and rural. um, how can people in rural areas kind of prepare for this? I know here in Sioux City, there's a lot of things going on, continually update new things all the time, but maybe folks who are in rural areas, not so close to a hospital, what are some of the things they can prepare?
So some of the big things to be on the lookout for. So I would definitely make sure you follow certain websites that give you updates as to what's happening. The Iowa Department of Public Health tries to keep you up to date. They actually have several different languages on their websites too, and discuss
Okay.
different types of situations, which is great. I think following reliable sources of information like that is important. Social media, as tempting as it is to believe everything on social media, a lot of what's up there is not true. So make sure that there is a valid source, that you're talking to your doctor, that you're talking to your provider, that you're looking at the CDC or the WHO.
Yeah.
Those are valid sources where you can find real information. As far as what to do if you're falling sick or you're concerned about being sick and you're out in rural Iowa or actually anywhere in the 4th district, call your clinic. We don't want you to come in because if your symptoms aren't the coronavirus, you might be coming into a clinic filled with people who are infected and in fact get the infection that way. And if they are the coronavirus, then we don't want you to be that person that comes into the front door and gets everybody else sick. So we will give you service. We will make sure you get what you need. But the thing is, if you call the clinic first, we can prepare and figure out how to do it in the best way to protect you as well as to protect the other patients. A lot of clinics, mine included here in Fort Dodge, we're offering certain curbside services to try to ensure that we keep people safe who might be coming in for other issues, or we keep people safe if you are coming in because you have symptoms of coronavirus. So we're trying to accommodate and ensure that people get the care they need. We're also doing telephone health visits now, just doing anything we can to give people the care they need while also protecting and trying to social distance as much as possible to reduce the transmission. So even if you're in rural Iowa right now, you can call to your clinic. You can say, hey, I'm concerned about these things. We can do a telehealth visit either of the phone. I can even have a video chat with you as a doctor. So a lot of these things we're accommodating that should fulfill both rural and the more urban areas of Congressional District 4. The other thing to also know is if you don't have a doctor because you just didn't have an issue, so you weren't seeing somebody, that's okay. A lot of the clinics, mine included, we recognize that there are a lot of people who have questions now, might develop a slight cough and get worried that it's coronavirus, that there's a lot of people who suddenly need care that didn't have it before. You can still call us. All of the clinics really are open trying to help anybody that needs it right now, whether you are a previous patient or not.
That's amazing. Just again, so appreciative of everything that you guys are doing at the front line of all of this. It's as just someone living in the area, we're so appreciative. What could you talk a little bit about? I know you mentioned a little bit before social media, and you can't believe everything. Are there any myths that or not even myths, but like what are things that we don't know compared to things that we do know? And again, we're constantly moving, and each week it's different. And so I guess the best of your ability, could you talk to that a little bit?
Sure. So what we do know, we know that about 50% of the population in the US will likely be infected at some point. Some people have already been infected and had no idea. Some people are yet to be infected. So we do know that it's going to hit a lot of people. And this is because nobody has protection to this virus. It's a completely new virus. It's not like the flu where we've been exposed to something similar in the past or our bodies have a little bit of immunity. And we also have no vaccine for it. So nobody is protected at all. So because of that, 50% of the people are going to be infected. And then on top of that, 80% of those people are probably going to not notice having an infection at all, or if they do, it's going to be very mild symptoms. So those are good things. They can still pass the virus though. And that's why it's so important to socially distance. It's so important to stay at home because you don't want to be the one that passed it to that 20% of people who end up in the hospital severely ill. You don't want to be a part of costing somebody their life while you only had mild symptoms. And the best way to do that, the best way to ensure that your neighbors are safe, that your community is safe, your parents, your brothers, your sisters, are to make sure that you stay at home. The other things we know about this virus. In other countries, we've seen that those who are older than 50 have a higher chance of having severe illness. And those that have a history of some other medical ailment, whether it's diabetes, heart disease, cancer, organ transplant, also at higher risk. But we can also see that that does not preclude the younger, healthy population from getting really ill. About 35% of cases in the US have been in the population of people between the ages of 20 and 44 years old with no past medical history, meaning somebody like me or somebody like you, JD, who completely healthy, also severely ill and unfortunately passed away. So we have to keep that in mind. Nobody is safe from this. Even if you are extremely healthy, nobody is safe. And that's why it's so important we all take the precautions.
Yeah, I had a friend from many moons ago. I've lost touch a little bit, but he texted me out of the blue to say he had it. And he said, this was a week ago Saturday. And he said, I've been out, like this might be my last text to you. And then he said he was near death, but then he bounced back, and I talked to him over the weekend, and he's doing a lot better now. And but he's like, if it affects me, it can affect anybody. And he's a healthy person. He was an athlete and everything. So it's always hits you different when it's somebody you know as well. And so it's all around us, what I'm hearing. And so we all got to be safe and take care of each other. And so
Exactly.
Yeah. I don't want to take too much of your time. I got just one last thing for you. In all of this, again, we're so appreciative. I know it's Zoom, it's just you and me, but there's a lot of people watching too. And I'm sure they'd be applauding you if they could, if they knew you could hear. But just thank you so much. How are you holding up? And how are medical professionals holding up in these uncertain times?
And we've got some amazing people that I work with here in Fort Dodge, in North Carolina, and colleagues all over the country. We've got some really amazing nurses, some amazing CMAs, amazing respiratory therapists, doctors. I mean, it's a group that I feel honored to be included in right now. And just because I see everybody put aside their own concerns about their own lives because it's all about trying to do their duty. It's the reason we entered healthcare, because we wanted to be there to help people both in the highs and the lows of their life.
Yeah.
And so being there and during this pandemic is another part of it. And I'm really lucky to have the colleagues I do.
Yeah, that's we're so appreciative. We did receive one last question.
Please.
Is there any information on reinfection after the recovery, or could we have to go through multiple social distancing cycles until a vaccine is developed?
So it's a really great question. And that's yet one of the things that we don't know. So there was a case in Japan where we suspect that somebody was actually reinfected after clearing the infection themselves. It was still being investigated. The most recent data is pointing more towards an actual reinfection rather than just having a flare of the same infection, which does make us wary that potentially there is a chance of reinfection with this virus. That being said, most viruses, you usually do develop immunity afterwards. So that's why the antibody tests that people are developing right now are so important. So we can kind of gauge if that was just a few people that are at risk of reinfection, depending on their body's ability to build that immunity after the infection, or if this is going to be a more widespread problem. We suspect that it's likely the former. And so the antibody tests are going to help us confirm that. And we're actually in a few different institutions. So one of the places that actually where I went to residency, Johns Hopkins, they just started a study looking at utilizing plasma from people who have already recovered from the infection, hoping that there's antibodies there to help treat people who are severely ill right now. So if that is the case, and if that is effective, then we assume that most people will develop immunity. So we're very hopeful, but it's one of those questions we still don't know the answer to.
We got one more question. Sorry, they keep on coming.
Fine. No. The more we can more myths we can dispel, the better.
Good, 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 and appreciate your time. How can we get across to people who cross that cannot be gathering? We are most effective. What's the most effective way for public health strategies and talking to folks saying, hey, we can't really be gathering at this time?
Yeah, so it's a good question. I wish I had the answer to that because then we could get everybody to
Right.
understand. um, there, each person's going to be different on how we can get messaging to them. Whether somebody's a visual person, whether somebody is in a certain type of industry, and you can use a type of metaphor to make them understand. I've seen some pictures that are very effective at showing exponential spread. I've shared a couple of them on my social media to try to help with that. And I've seen others who like the match picture that they've
Yeah.
seen. That's helped some people. So I find that visuals are the best way. And currently, actually, a group of my colleagues and I are working on creating short animation videos to release. And hopefully, we'll have our first one out in the next week or two, so we can kind of hit education that way. But we're just trying to amplify the right information however we can, and it's a great, great effort that you're trying to do if you're trying to do that as well, whoever the question asker was. And I really appreciate you trying to find ways to do that. I would say pictures have been the most effective for me to try to draw and show why one person staying at home can influence a whole series of people not getting ill afterwards. And I think that hopefully we can slowly spread the message, but ultimately, in all honesty, we're not going to hit everybody. And that's part of the reason why stay-at-home orders are being recommended at the federal level, to have every state follow through with that, because this virus knows no borders. It's not going to hit Nebraska and decide to skip over Iowa and hit the next state along the line. Viruses don't respect state borders. They don't respect city borders. They don't respect county borders. It's going to go everywhere. It might take longer to get to some places, but it's going to go everywhere. And that's why it's so important that we all recognize we need to stay at home, and why we follow through with the federal recommendations, that we issue that at a state level.
Another good question here is, there doesn't seem to be a lot of data from people who have recovered. In why is that? Or is there, and it's just like it's still all new, or yeah.
There's some data out there on recovery, which is why they're starting to have these studies where we're able to get the plasma from people who have recovered and utilize it to see if it does have an impact on helping those who are still severely ill. But one other aspect as to why there isn't as much as we'd like is because, well, it's two things. First, the people who are more likely to have recovered already from the illness are those that had very mild symptoms. And because we haven't been testing on a widespread basis, we haven't been testing those people with mild symptoms to recognize this person was ill and has already recovered. The people who are more severely ill that have been receiving the tests, appropriately so given our lack of tests right now, they are more likely to have long-lasting symptoms. In people who are severely ill, we can see the symptoms lasting anywhere from 4 to 6 weeks. So getting to that point of saying that they are recovered, especially when this really just hit the US very hard in the last month, is going to be a little bit too premature right now. So it's a combination of not having enough tests to discern who the mild symptoms were that have already recovered, and then the fact that those with the severe symptoms that have been identified are still on the trajectory to recovery in most cases.
That's great. Do you have anything else? Did we miss anything? I know there's so much you could do. We're going to write volumes on it, but is there anything in short immediate term that you want to get out as well?
Yeah, one of the things that I've heard frequently is that if I gather together in a group of less than 10 people or less than 5 people, it's okay. I'm still respecting social distancing. And part of that has been because there has been mixed messaging from different levels of government, saying initially that was okay, and then others saying that it's not okay. I want to clear that up right now. It's not okay. Because what happens is, if JD and I get together with 4 of our friends, and then I go and I give them all the virus because I'm infected, and they get together then with each of their 4 friends, still under 5 people, but that is each of them passing it to 4 more people, which is 16 people that are now infected from that one contact with me. And then those 4 people will go and hang out with 4 additional people. So it just keeps on perpetuating. So really the only way to stop that spread right now is to not hang out with anyone in person. Social distancing does not mean isolating yourself socially. It means physically distancing yourself from people. You can still hang out. JD and I are having an awesome conversation right now, but we're just doing it virtually. Still be there for each other. Make those phone calls, make those FaceTime chats, check in with each other. We're all in this together. It's a stressful time, but we're also doing this to protect each other.
You know, over the weekend we had nice weather, and I was out working on the yard, and it was really nice to talk to folks, but like we kept our distance. Everyone was very cognitive of that. It was really cool to see the block coming together. And I mean, you know, as well as I do, living here in Iowa, our communities are so strong, and it's really cool to see them coming together on different things and something like this. Before you go, where can people follow you so we can continue on with everything and making sure that we get
definitely. So you can follow me on Facebook, Megan Srinivas. It's Megan, and then Srinivas, Srinivas. Also, Megan Srinivas for Iowa is my public page too. And then on Twitter, you can follow me at Your Local ID Doc, and also on Instagram at Your Local ID Doc. I do put up daily updates, just kind of discussing tips and a few images that you are welcome to share with anybody who you think might need the education or might benefit from the education. So the more people that get out the right message, the more prepared we are as a state.
Awesome. I had to write it down so that if you saw me, that's it. I didn't know you had it.
Oh, you're good.
When we join in, I'll be sharing it too. So just thank you so much. Again, we all are in this together, but we're so appreciative of folks like yourself stepping up and really answering the call in this time of uncertainty. So thank you so much for the information. And
of course.
I hope you have a wonderful day.
I appreciate it. You too. Stay safe, everyone.
All right.